Acute hepatic porphyrias are inherited and metabolic diseases related to the heme biosynthesis. The main organ is the liver, which releases high amounts of porphyrin precursors into the circulation if precipitating factors induce ALA synthase. Since porphyrin precursors are neurotoxic, clinical manifestations include commonly a combination of symptoms and signs related to central nervous system impairment and autonomous and peripheral neuropathy. Very commonly, an acute attack starts with mild mental symptoms such as tiredness, irritability, and sleeping disorders, and continue with severe abdominal pain, nausea, and vomiting. If the attack continues, pain in the back and limbs will be present. Constipation, palpitation, and hypertension are also common signs of sympathikotonia. Seizures, blurred vision, commonly associates with hyponatremia, may occur due to press if the attack proceeds. Muscular weakness, paresis, especially respiratory failure, Pauper palsy, arrhythmia, and reduced consciousness are alerting signs, and the patient should be treated in critical care unit, and proper treatment should be started immediately, since even now 10% of the attacks are fatal if the diagnosis is missed. If the patients have attacks several times a year, chronic pain syndrome, tiredness, and muscle weakness may occur. Givosiran is a short RNA fragment which is targeted to the liver, and it inhibits the gene expression of ALA synthase 1, which is the rate-limiting enzyme in the pathway. The drug is administered subcutaneously, and it results in a dramatic decrease in the formation of porphyrin precursors, as shown in phase 1 and 2 studies. The main aim of the ENVISION 3 study was to prevent clinical manifestations of acute hepatic porphyria. ENVISION 3 is a multinational study in which 94 patients with acute porphyria were enrolled for 6 months. The study was randomized, double-blind, and placebo-controlled. Almost 50 patients in both groups did not differ from each other clinically, but all patients had a very severe form of the disease, since the majority of the patients had suffered from recurrent attacks for years. The primary endpoint was the attack rate, and the secondary endpoints were, for example, biochemical reduction of porphyrin precursors, use of hematine, which is the current drug used for attacks, and reduction of pain sensation, and use of painkillers. The main result is the fact that givosiran led to substantial reduction of number of attacks, and 50% of the patients in givosiran group had no attacks during the study period, compared to 17.4% in the placebo group. The attacks were milder and less frequent, and even severity of chronic symptoms and use of painkillers diminished during the short follow-up time. Adverse reactions were tolerable, mainly related to mild to moderate increase of liver transminase activity and reduced renal function, which were transient. For patients, the most important thing was to stop acute attacks. And thus we were lucky, since both attack rate and severity of attacks could be reduced. Pain seems to be the most devastating symptom, and the patients have hard time to cope with that and to live without opiate use. Reduction of pain increased immediately the quality of life and well-being of the patients. Givosiran is a new type of a drug and amazingly efficient, and it can stop the vicious circle of the patients with acute hepatic porphyria.